working in Vietnam with disability, talking about some of the culture and how that culture influences the perspective towards the disability community. And then concluding, just talking about some ways to move forward from that. So I just want to let everyone know that this presentation is not centralized on disability law because I'm not a law student. I have more of a public healthcare administration background. So, but it is on disability community culture in Vietnam, just to give you all, I guess, an international perspective of what disability is like in other parts of the world. So the VIT Fellows Program. I was a part of this program in 2011, and basically it's an incubation project of APIP, which is also known as Asian American and Pacific Islanders and Philanthropy. And our mission and purpose is we invest in the leadership of young Vietnamese Americans in the U.S. as well as in Vietnam to improve the quality of life for the U.S. and Vietnam communities, specifically towards the disability community. And our focus is on Agent Orange because Agent Orange is one of the most pressing problems right now going on in the community, both in the U.S. and in Vietnam. And so, you know, investing in the leadership and the capacity of young people will hopefully to inspire and promote them to create change in their communities. And I was a part of this fellow program, like I mentioned, 2011. I was there for about 6 months. I worked with a local NGO in Da Nang City, and then working on the issue of disability and you know, visiting the communities, just kind of understand what they're going through and seeing their perspectives. So Agent Orange. Agent Orange is a big issue right now in terms of health environment. It's during the Vietnam War, the U.S. forces sprayed millions gallons of Agent Orange over the landscape of Vietnam. And over the, from 1961 to 1971, over the span of 10 years, I believe there were more than 20 million gallons. And of the 20 million gallons, more than 60% were Agent Orange. And Agent Orange is contaminated with dioxin, which is a very, very toxic contaminant that doesn't really degrade easily, which is a huge problem because it tends to cling into the soil particles, and then it gets transported by runoff into the lakes, the rivers, and the streams, and then this potentially can get into the human food chain. So, for example, fishermen fishing at these streams, they can, they fish, they consume the fish, and then they themselves get poisoned with dioxin. And currently, there are many hotspots in Vietnam right now. And hotspots are areas with very high concentration of dioxin. And they are based around the former U.S. military bases, which makes sense because during the Vietnam War, the barrels that that contain Agent Orange are at the bases, and then they leach into the soil, and then that goes into the streams and then into the human food chain. And some of the health effects, and these are just some. The list is long and hard. Cancer, heart disease, diabetes, birth defects, and other disabilities. And they're genetically carried from generation to generation. Sometimes they do skip generation, but it is an ongoing process, and that's why Agent Orange right now is such a devastating problem affecting the community. So how does culture play into all this, and how does culture really influence the way that the community in Vietnam and in the U.S. perceive the disability community? In Vietnam, there's a huge emphasis on collectivism of family and community. So, some of the core values, harmony, the family and the community, they emphasize the importance of practicing moderation and not going to the extreme. So really following the societal norms and not branching out too much from the unit that they call, the family or the community. There's also a sense of duty and honor because every family, every community wants to maintain faith. They don't want to bring shame to the family, and so sometimes having a child with disability or a family member with disability, that's bringing shame into the family, even though it wasn't their fault to be born with birth defects. And also there's a sense of respect and reverence for elders and ancestors. The idea of filial piety. You got to take care of your parents, the elders, when they're older. And so, some of these cultural aspects that I just mentioned, how does this really influence a perspective on disability? Currently, there are two views on disabilities, one being the traditional view, where this is largely influenced by religious beliefs and cultural values. And the community that I visited, that I worked with in Vietnam over that 6 months, they believe that disability is the result of bad deeds and sins that were committed by their ancestors. So their great-grandparents or grandparents, they did something wrong during their lifetime, and so now their children, their grandchildren, will have to pay for it. And as a consequence, they're born with a birth defect. And this is the traditional view. There's also the new view on disability, where the VIT Fellows program focuses much more on, because it's more scientific-based, and it's less influenced by religious beliefs or cultural values. Since the Vietnam War, there's been a lot more evidence linking Agent Orange to certain diseases and disabilities, such as cancers and diabetes that I talked about. And now, people with disabilities are viewed as victims of war and not victims of their ancestors' wrongdoing during their lifetime. And because of this new view on disability, in 1998, the Vietnamese government established what is known as the Ordinance on Disabled Persons. And what this ordinance does is that it provides accommodation, inclusion for people with disabilities so that they can equally participate in society without discrimination and stigma. And I mean, even though this ordinance is out and about, it doesn't get everywhere, especially for families in the rural areas, because they have really no idea of finding out what this is about and information to really understand what this means to them and what kind of rights they have. Now I just kind of want to talk a little bit about my experience. I was in Vietnam for 6 months, and while visiting the communities and working with the families with disabilities, I observed that there's a traditional view that a lot of families hold. They themselves believe that their parents or great-grandparents did something wrong, and so now their children who are disabled are paying for it now. And that's a belief that many families hold. And in terms of the community, they view people with disabilities with pity. They're abnormal and they're bad luck, and they're bad luck for the family and they're bad luck for the community because of what their ancestors did. There's really little to no opportunities in employment, education, marriage, and social integration, social participation. And in the family, a lot of children with disabilities, they feel disregarded and ignored by their own family members, by their parents, by their siblings. And a lot of times they also feel that they're a burden forever to their family. And over time, this becomes like a self-stigma, self-discrimination, because they think that it's their fate. Their ancestors did this, did something wrong, and now they're going to pay for it, and that's it. There's really no questions asked, and they're going to accept it as their fate. And one of the experience that I had that I thought was really interesting to me was that, visiting one family and talking to the parents, they told me that, they have 2 children with disability, one a son and one a daughter, and they would rather pay for their son to go to school instead of their daughter, because they feel that the son will have much more benefits from it than their daughters. And also, financial needs as well. They don't have the financial needs to pay for both children. And also there's a sense of pride, pride in having multiple children. A lot of the parents, they see that having children with disability is shameful to the family, shameful to the community. And a lot of times, they refuse to believe that their child is actually disabled. And a way that they work through this, a way that they face this is going to the doctor and going to the hospital and saying, do you have, medicine or some kind of surgery to fix my child? Because, she or he can't be disabled, that's not the reality of it. And so sometimes they refuse to believe that. And if that doesn't work out, then they hide their child in a very, in the room with no light, it's very sad. But a lot of times this traditional view on disability is very strong, and a lot of families believe that. So moving forward, as I mentioned, that being part of the VIT Fellows program, we are focusing more on the new view on disability, that we feel that there's a critical need to really change the overall negative and dismissive societal attitudes that are hampering the advance of people with disabilities. We can't think that their ancestors are doing this. We have to look forward and find a different approach in dealing with this. And there's been a lot of support from both sides, both in the U.S. and the Vietnamese government, to deal with the issue of Agent Orange and disability affected by Agent Orange. And one of which is the U.S.-Vietnam Dialogue, and this is a group with prominent private citizens, policymakers, scientists who meet a few times a year to really discuss the issue of Agent Orange and how to move on from there. The U.S. Congress has allocated millions of dollars for the past 3-4 years for cleanups, in these hotspots, cleaning up the soils, and a lot of money going to public health programs, Medicare, education, and community awareness to really help the community get together and really understand the issue and understanding how to move on instead of going backward. There's also been a lot of support from the local and international NGOs. For example, the one that I worked at, we focus on the issue of disabilities and providing education, rehabilitation, vocational training for children with disabilities. And some of them are affected by Agent Orange. And we also have the Agent Orange Relief Act of 2011. And this is the yellow, the orange postcard that I can pass around later if anyone's interested in supporting. But what this act is about is basically to urge the U.S. Government as well as the Vietnamese government to pass this act so that we can provide more assistance, programs, and services for families who are currently being affected by Agent Orange, and really getting to the core of the issue so that we can move forward. So that's pretty much my presentation today. I just want to thank APIP and VIT Fellows for their opportunity to work very closely with the disability community and really understand the issue. My director, Tony, for really helping me prepare this, and of course to Steve for giving me